For this vlog post, I will be adding to my first post in regards to my mom passing away about 6 years ago. I will be briefly talking about hers and my experience with her providers, but I don't really remember too much about my mom's interaction with her providers since I was not present for most of it. But I'll talk about what I remember. On page 58 of Patient and Provider Interaction by Sparks and Villagran, it states consumerism and healthcare implies that well-informed patients are best equipped to decide among treatment options and that control over decisions should lie solely with the patient. That falls under the second approach model to provider-patient communication. I feel like my mom fell under this approach because she was never really involved in her treatment plans. I mean, she was, but not as much as she should have been. My uncle and my aunt were mostly in control of her treatment since they are both psychiatrists themselves. Towards the end, I would take her to her doctor appointments and take over when she came back to San Diego. I remember my encounters with the providers were fine, but recently I have learned that my mom's encounters were not fine at all. They were just horrible, they didn't listen, and I was so shocked when I learned that news. Whether because of old knowledge or just poor communication. The relationship between physicians and patients play a crucial role in patients' health outcomes. Medical encounters have been characterized by control, role negotiation, healthcare commitment, trust, and time and money issues. That's page 58. Recently, I was told by my aunt that the relationships my mom had with her providers were really bad and not interpersonal. They never really listened to her. They just wanted to fix the problem fast, but it wasn't successful. On the other hand, my grandma is experiencing a similar battle with cancer, but her experience is the complete opposite. She loves her providers. She actually moved to Hawaii last year, but then the cancer came back, so she wanted to go back to New Mexico, where her original provider is stationed. So she loves him. She does everything that he says. It's amazing. He even offered to drive her places if she really needs it, and is just a really great doctor overall. It was fortunate that my mom didn't have that experience, but I am happy now that people are learning to become better communicators and have better knowledge about this horrible disease. Thank you.